this is part 2 of setting up for an isokinetic knee flexion extension test. So we've got the dynamometer ready, we've restrained our participant, we're basically good to go. So at this point, we just ask our participant to straighten out the leg that we're testing, place our foot on the paddle, and we bring the participant forwards. At this point, we're just guessing where we think, relax your neck there, the axis of rotation of the tibiofemoral joint is. We'll do a separate video on how to find that, which you can watch when you're ready. So we're also just going to guess at this stage where we think the dynamometer head should be placed in the fore and after position. Remember that when the test is performed, we expect there to be vertical alignment between the center of the hip, the knee, and the ankle. So your participant shouldn't be kicking out to the side. There should be a straight line when viewed from the front between the hip, knee, and the ankle. Could you roll these up to the side, please? Thank you. So, as a general rule of thumb, we say that from the lateral malleolus, which is the most distal and lateral portion of the fibula, but for the sake of the video, I will use the medial malleolus so you can see what I'm doing. The medial malleolus, though, does sit slightly higher than the lateral malleolus, so you do need to make sure you're using the lateral malleolus. That's the most distal lateral portion of the fibula. The medial malleolus is the most distal medial portion of the tibia, so there is a slight difference. So, we say that we have roughly, and the medial malleolus is there, a 2 fingers width distance between the medial malleolus, or the lateral malleolus, and the base of the attachment of the pad here. So you can just unscrew this attachment here, shift this up, and just feel where that needs to go. Now, obviously this is somewhat subjective, because your fingers might be wider or narrower than mine, but this is just for a performance test. Were we doing research or something where this needed to be standardized more thoroughly, we would get a tape measure out. But for the sake of doing a performance test where we don't have to standardize it as thoroughly, we can just say 2 fingers width because it's still standardized between participants. But the short answer as to why we do this is to make sure that there's a standardization between your participants or your athletes. So at this point, we just undo the attachment, rest our participant's leg in there, take this round here, bring the Velcro around, make sure the pad is in the middle here, not to the sides, and nice and snug, seal that Velcro around. So then we can just check that our participant is comfortable by asking them to perform some flexion extension movements, full range of motion. And does that feel comfortable to you, Gary?
That's fine.
Excellent, mission achieved. And at this stage, we would also take the opportunity to see if there is alignment between the ankle, the knee, and the hip. If not, we would adjust the position of the dynamometer head forwards or back.